Hey everybody, welcome back to my channel. I'm Tabuti. With all this Trump stuff going on, the news media is focused on everything Trump. But did you hear about the 29-year-old woman who is in a vegetative state, living in a long-term care facility, giving birth? Yep, that's what I said. Giving birth. Yep. That's not the worst part. The care facility workers, no one was aware of the fact that the woman was even pregnant. She was overheard moaning. And that's when they found out she was pregnant. She gave birth to a baby boy in December in the facility. A 911 call was made, and you could hear the person that made the call telling the 911 dispatcher that the woman was in birth, and they were not even aware that the woman was even pregnant. I know you say, what? That's just what I said. Yep. But due to her being pregnant and in a state where she could not communicate, therefore she could not give consent, a police investigation occurred, and all of the male workers had to submit to a DNA test. A 36-year-old nurse who was assigned to this patient or victim has now been arrested. Yep, you heard what I said. Her nurse has been arrested. According to what one of the employees reported, or a parent of another patient reported, he worked night shift. Well, this is just absolutely horrible. Her family was outraged when they found out, just outraged. And they always thought the facility was a very nice place. But, and according to other patients, they thought, patients' families, they thought that the facility was a very nice place. And one woman who has a son in the facility said that she thought that this nurse, when she heard who was charged, she was in shock. She thought he was a very loving and compassionate person. At least he appeared to be that way. This is absolutely outrageous. One of the questions that I have is, why would a male nurse be allowed to be in the presence of a female patient without having someone else present? Yep. And someone reported that, I believe it was another nurse, that she would generally go with this particular nurse into patients' rooms. But she, at this particular patient's room, she left, the nurse left out, leaving the male nurse, and he would stay in for extended lengths of times. But obviously she didn't question it, because by all accounts, he was seen as a very nice, professional person. It was also reported that, of course, when you work in residential facilities of any kind, background checks are done on you. He did have a drug screening, and he had a clean record. This is the thing. How could she be pregnant? And no one knew she was pregnant. Doesn't she and the other patients get baths? Aren't they seen by doctors for medical checkups? Somebody please answer that question for me. How can you not see a woman's protruding stomach? And as I read, one of the other patient's parents said, how could you not know that this woman was no longer having a period? It's absolute neglect, not to mention abuse. This is horrible. I'm bringing all of this up and talking about this particular situation because I've worked in residential facilities with abused, neglected children for over almost 40 years. And as in this long-term care facility, in residential facilities, and I was recently in at the hospital with my sister. On the graveyard shift, there are less workers because the residents are more likely to be sleeping at that time. So the need for more workers isn't necessary. But like in this situation, more things can occur. Abuse and neglect because of the lack of supervision. This is a warning to everyone that has a family member in a residential facility, in a skilled long-term care facility, in the hospital, just like daycare centers. You need to be vigilant. You need to visit that family member, whether it's a child or an elderly person. You need to visit them on a regular basis. I would suggest to you that you come at different times of. If you have any comments about what I've said, or let me know your opinion about this situation and other situations where people are in hospitals or residential care, daycare centers. Give me your opinion. Let me know what you think, because this is just my opinion, but also based upon work experience. It does happen. And the most deceiving people sometimes are the nicest, most professional people that you work with, that you meet. They're in your family. Thank you and have a good one. See you later.